Good morning. Thank you, Prof, for introducing me to the audience just now. Okay, actually, I came all the way from Malaysia, okay, just to share my little knowledge with you all. But anyway, first of all, I would like to thank to the IPC for inviting me to be here, all right, this morning. Okay, to just to share whatever that I have learned in Malaysia, okay, and what we have done so far in Malaysia. And I will limit my discussions in pediatrics pharmacy only. Actually, when we talk about quality pharmacy education, okay, we follow whatever the international guidelines that we have got. Okay, the way back in 1980, when we came back from US, okay, actually 6 of us were sent to US to learn about clinical pharmacy. We were sent to all of us were sent to one university, University of Minnesota in Minneapolis, because at that time, the only few universities in US have started the PharmD program. And one of them is University of Minnesota in Minneapolis. There are other universities that have offered PharmD, but they do not take international students. They do not enroll international students. Only University of Minnesota at that time enrolled international students. So we all 6 of us went to the same universities, and we learned from the father of clinical pharmacy in Minneapolis. One of them is Linda Strand, which is the mother of the pharmaceutical care. Then when we came back in 1980, we started okay, the clinical pharmacy. What we have done was we learned the need of the population in Malaysia, the public in Malaysia. What are their needs when we talk about clinical pharmacy? So we call all pharmacists from all over the country. Okay, we invited them okay, to join what we call it refresher course. Okay, when we talk about clinical pharmacy, and before we start, we ask them what they are offering to in their hospitals, and then we also trying to find out from them, okay, what are actually the need of our population when we talk about pharmacy services. Okay, then from there we move on, okay, to train them. Train all the pharmacists in the hospital, from the hospital into our clinical pharmacy. And we help them to start the clinical pharmacy practice. Okay, 6 of us started different areas. I myself started in total parental nutrition and pediatric pharmacy. And then one of my colleagues in therapeutic drug monitoring. Another colleague worked with the drug information service. And finally, we have managed to develop National Poison Center in Malaysia. So all these services later on we develop in all hospitals. Okay, from university we go to the hospitals. Once we have got services in hospitals, then we train our students, okay, in clinical pharmacy. We in all universities in Malaysia we request them to include pharmacy curriculum in their curriculum. So all the final years now in Malaysia, all the final pharmacy curriculum in Malaysia are actually all are related to clinical pharmacy. Then to develop the competencies of the student, we send them to the hospital that we have developed the services earlier. So we have got all hospitals, in general hospitals, with all the clinical pharmacy services that we have developed earlier. Then we send the student for training there. Okay, we do not send students to hospital without the clinical pharmacy services for trainings. Then from time to time, we improve the curriculums, okay, based on the need of the populations. So as I mentioned earlier, we started with improving the teaching facilities. That means the hospitals for the clinical pharmacy. We improve the hospital services. Then from there, we move on by training the lecturers. Okay, we send lecturers for clinical pharmacy trainings. We're sending more and more. Okay, in US, they have got PharmD trainings, which at that time was only 2 years. But after that, they converted all direct PharmD. So if we want to send our students for PharmD, we need 6 years program. So we send to Europe, okay, to do PhD in clinical pharmacy. But in Europe, the PhD in clinical pharmacy they are very narrow area where they will learn only specific area of clinical pharmacy. For example, They learn about cardiovascular pharmacy, nephrology pharmacy, and so on. So nowadays, most of our lecturers have got this specialty: nephrology pharmacy, oncology pharmacy, and so on. Okay? Then, based on economics, okay, we continue to train the lecturers. We're sending lecturers to overseas, and sometimes for private universities, we will train them locally. We send them to the public universities, and also we provide them with the in-house training, okay, to improve their clinical skills. And of course, we will take them to the publics, okay, so that they will appreciate, okay, the need of the publics when we talk about clinical pharmacy. And starting in early 90s, in Malaysia, we have got accreditation bodies. Our Board of Pharmacy work together with the accreditation body, okay, to accredit all the pharmacy programs. So the pharmacy program in Malaysia basically are standard. We have got standard curriculum, where the curriculum are controlled by the Board of Pharmacy. So we set the direction, the board will set the direction, and then all the universities have to follow, okay, the curriculum that is required by the Board of Pharmacy. At the same time, okay, we also subscribe to the international benchmarking. We follow the FIP and we follow ACCP, okay, American College of Clinical Pharmacy. In 2016, okay, we have moved into what we call it outcome-based learning. So the Board of Pharmacy, together with the Board Accreditation in Malaysia, so we request all the universities that are offering pharmacy program, we should subscribe into the outcome-based learning. And the board have designed the outcome. What are the outcomes that each faculty is supposed to achieve at the end of the program, the learning outcome, and so on. Okay, among the outcomes that we have designed was the knowledge, practical skills, and skill for social responsibility. Okay, this is very important, and this one can be given through lectures and so on. But managerial skills, information management, and lifelong learning, because right now the information management is very important. We are teaching Generation Y students, okay, and our country have subscribed into the Industrial Revolution 4.0, where information technologies is becoming very, very important. So now we request, or we require these information technologies to be part of the pharmacy curriculum. And also the problem-solving skills. Okay. On the top of that, we also require the faculty to inculcate, okay, the values, attitude, and professionalism to all their graduates, so that when they graduated from the university, they should be able to practice and supposed to be able to communicate at leadership and teams and so on. Okay, so these effective domains, okay, we inculcate throughout the 4 years of the pharmacy program in our university. So how do we deliver these particular things? Is depending on the material, the thing that the goals that we want to achieve. So for example, for basic sciences, physiology, anatomy, biochemistry, pathophysiology, and statistics, we use lectures, tutorials, okay, case studies, and PBLs, okay, problem-based learnings. Now it's being part of our mode of delivery in our curriculums. And then skills in patient care and so on, okay, we inculcate into the curriculums, okay, by simulation. Before we send a student for training, we have sent student for simulation trainings. Okay, we have got a very good clinical skill lab, okay, where the student can practice using dummies, using mannequins and so on, okay, so that they won't make an error when they go into the ward to see the patients and so on. Okay, and we also have got role play where the student and the other students, okay, for them to learn. Self-reflections, okay, sometimes we videotapes, okay, what the activities that they have done, okay, and they later on we show it back to them. So we ask them to give comment on their own skills. Okay, this is the way that we're trying to improve the student skills. Okay, so we ask them to do, and then we take the video, and then we show it back to them and ask them to comment. Okay, so they will find their own mistakes. It's not we pinpoint the mistake for what they have done and so on. Okay, and of course the hands-on and clinical attachment is in the final year. In the final year we send to the hospital that we have got the training earlier, then they will learn from the pharmacists that we have trained in 1980s, 90s last time. For the affected domain, okay, and then we introduce the code of conduct in the first year. When they enter into the Faculty of Pharmacy, they introduce them to the code of conduct, and then cutting right attitude to the professional practice. Okay, throughout the year, okay, we use what we call it this formative evaluation. So from the formative evaluation, we do not count the marks, okay, for the final marks of the examinations, but from there we can improve the student achievement and so on for the formative evaluations. Say for example, we give them quiz. If they cannot answer, then we will improve. So every student, when they graduate from the institute, is supposed to have the same skills. Right? And then we also have got a field visit, okay, we call it this outreach services and so on. Okay, we take them to visit the rural areas, we take them to visit the Aboriginal areas and so on, so that they will be able to appreciate how difficult these people, okay, this population to get the medications. Say for example, we took them to one Aboriginal area or native area. It's about 60 kilometers from the nearest hospital. So when they are ill, how to provide medication for them? Okay, where they will go to get their medication and so on. Okay, so then from there they will appreciate, okay, the value of the medication that they're going to dispense and so on. Because in Malaysia, medication are provided free to the patients. Okay, we do not charge. Okay, the patient go to the public hospital, all the medication will be provided free to them. So some of the pharmacists, they do not appreciate the value of the medication and they just dispense whatever prescribed by the doctors. And at the same time, we expose them to the clinical studies related to the pharmacoeconomics of the medications and so on, so that they will be able to learn, okay, the importance of the role of pharmacists in improving, okay, the economic as well as improving the patient outcome. When we talk about pediatrics, actually, because pediatric populations, okay, most of the time when we talk about pediatrics, most of the students we have in their mind is that pediatric actually small adults, which is not correct. Okay, pediatric is different populations because they have got different physiological functions and so on, because most of their organs are still in developing stage. Okay? Therefore, we cannot assume pediatric is equal to the small adults. The dose calculation cannot be calculated based on the body weight of the patient, just using the adult dose, and we calculate based on the body weight of the patient and so on. So we have to calculate, we have to teach them, okay, about the effect of the physiological functions of the organs of the pediatrics. Okay. For example, the last time when I started the pediatric pharmacy service, we have got a case, okay, where the patient got biliary atresia. Okay. And we took our students, okay, we call all our students, clinical final year students, to see the patients. Okay. And then we asked them, what kind of medication that you should give to these patients? Okay. Some students, they just simply mention whatever antibiotics and so on. Okay. Then we told them, okay, the importance of the knowledge on the biliary atresia to the selection of medication. In biliary atresia, the patient unable to eliminate medications that is eliminated through the biliary system, then we metabolize in the liver, and then the byproduct will be eliminated through the biliary system. So in those kind of case, then we should select those products that are not eliminated through the biliary system. So those kind of knowledge, okay, we have to tell the student, to share with the student. So when we find any special cases in pediatric, we will call all the students to visit the patients, and we ask their ideas on how to manage that particular case. Okay. We have got one case here, for example. Another example is that patient, we have got we call it Cns infection. Okay. And this Cns infection caused by staph. Okay. And this already form a what we call it is lot of pus inside the brains, okay, and in the small what they call it, macules is surrounded by, you know, small dot of macules there inside the brain. And we call the student and ask the student how to manage this case. Okay? We give antibiotics, okay, there's good penetration to the brain, yes, that's right. But how about the penetration to that particular area, that pus, okay, pus area? So then the student can't answer that, okay, because it's not easy for us, okay, actually to select the right antibiotic to penetrate into the pus, okay, because the pus will form a cast and then that particular organism will stay inside the pus, and the antibiotic cannot penetrate into the pus. Once we start antibiotic, the organism will grow, okay, and the infection cannot be controlled. So finally, we discuss with the physician and so on, with the pediatrician. We make a burr hole and we inject intraventricular antibiotics to the patients. Again, the student will learn from there how to properly manage the case and so on. Because to achieve right concentration, to penetrate into the pus, okay, we need to have the right method of administration, okay, to achieve the desired concentration and so on. So that kind of thing, okay, we discuss with the students and so on. All right, so another thing when we talk about dosing errors, in adult dosing errors is mainly related to the prescribing errors, okay? But when we talk in pediatrics, basically dosing errors are related to the preparations. Okay, how do we prepare? How do we supply the medication to the patients? Okay, when I was in US, the medicine supplied by the pharmacy in unit dose. I mean the preparation is already prepared for a single dose. When I came back to Malaysia, they supply in bulk. Okay, even though in pediatrics they supply in bottles. Okay, say for example for ampicillin. So they calculated how many patients require ampicillin in the ward. Say for example, we have got 10 patients, they calculate those, then we give 1 bottle. And the nurse have to measure the dose for each administration. You can imagine the nurse are very busy and they have to measure the volume to be given to the patients. And the accuracy of that particular thing is questionable. Okay? When we talk about TDM, therapeutic drug monitoring, we measure the concentration in the blood, and then we do not deliver the right dose to the patients, then the dose that we have calculated may not be given correctly to the patients. Okay, so take example, if we calculate the dose of aminoglycosides, aminoglycoside, gentamicin for example, for pediatric usually the dose is very small. If you want to inject, the volume is very small. And you supply in vials to the patient, 80 milligram vials to the patient, to the ward. And the nurse has to measure, to dilute, and reconstitute, dilute, and given to the patients. So the accuracy of the dose may not be correct. Okay, so this is one of the errors that is quite common in pediatrics. Okay? Tenfold errors is common in dosing errors in pediatrics because the dose is very small, and sometimes the doctor write 10.5, 10.0, and so on. Okay, with 10.0, we discourage the student from writing 10.0 because it can make mistake. So if 10, then 10 only, or 5 is 5. Conclude, finish it. Okay.
You can wind up, sir.
Okay, thank you. Okay.
Yeah.
In general, okay, basically the clinical pharmacy, when we talk about imparting quality pharmacy, then we have to develop the facilities, okay, for teaching and staff development, okay, and then we select the area where we want to embark, say for the pediatrics, then we concentrate into that particular area, and we dedicate one staff. Okay, we do not rotate the staff, this year in pediatrics, next year in adults, next year in surgery, and so on. Dedicate one staff in that particular area, and we request them to be there for probably more than 10 years. Then they become specialists in that particular area. Without specialization, then we won't move anywhere. With that, thank you very much.